Hello, today we're going to talk about orthostatic hypotension, or what we commonly refer to as OH. Please take a moment to pause and read our disclaimer. In this video, we'll talk about what is OH, know what to do if it occurs, and know how to help prevent it from occurring. Starting off with what it is, OH is a drop in blood pressure that we often see with a position change when we go from laying down to sitting up, or if we've been in upright position for a long period of time without our legs being repositioned. What causes OH? When someone has a spinal cord injury and the muscles are not necessarily pumping blood up the same way to the heart and the brain as it did before, blood tends to go down with gravity, and so it takes away the blood that's necessary for our heart and our brain. The blood vessels are not constricting and the blood flow isn't allowing for that blood to go back up, and so we can start to see some pooling of the blood in the legs, such as swelling. And the symptoms you might experience are really feeling dizzy or faint. You may have experienced this prior to injury as well, if it's a sudden position change, such as if you first sit up out of bed really fast, you might feel like, woo, I feel a little bit dizzy. But that's the same thing that's happening, it's just a little bit more pronounced with spinal cord injury. You might experience some sweating. You could have what feels like a hot flash. You could have changes in vision, such as blurriness, double vision, in some cases ringing of the ears. What should you do if an OH episode happens? Well, you'd want to check that you're having an OH episode by getting a blood pressure cuff, checking your blood pressure. But most immediately, especially if you know what you're experiencing and you've experienced it before, lay back down in bed or tilt back in your chair. If you're in a manual chair and you don't have that tilt function, elevating your legs, putting them onto another chair, a couch, a higher surface to kind of help that blood get back up towards your heart. And then ensuring that you have compression garments on, such as compression socks or an ab binder. But to help prevent an OH episode from happening, we want you to sit up gradually and move slowly, especially in the beginning of your recovery. Really important to move slowly and kind of get your body used to not just having the blood pressure just tank and go down. Once again, we don't want to move too quickly. We want to make sure you're staying hydrated. So having access to water is extremely important, and having enough fluid in our body is going to be helpful for keeping our blood pressure at a stable level. Wearing compression, as you can see in this picture, this individual has an ab binder that is on. And then I mentioned compression socks. In the hospital, you're probably familiar with those white compression socks. We have another style that might provide a little bit more compression as needed, but that is something that can really help with pushing that blood back up while the muscles aren't necessarily doing that job. And then there's also medication that can be taken if the doctors prescribe it, and that is called Metadrin, and that helps the blood vessels to tighten and to not have as many episodes of OH. Over time, most people get used to having a lower blood pressure, and your new baseline is probably going to be a little bit lower. Your body will accommodate and you'll not experience these OH episodes. However, if you're doing things like in therapy, if you're working on doing a standing frame or changing positions, then once again, it'd be a good time to evaluate your blood pressure and make sure that it's staying stable so that you don't pass out. What questions do you have? Make sure that you pass them along to one of the rehab educators or one of the other members of your medical team. Thank you so much for watching, and references are available upon request.